India's National Health Policy Framework guides the country's health sector strategy. From an examination perspective, the focus is primarily on evaluation of health policies and the details of the latest policy NHP 2017. So let's come into evaluation of national health policies. NHP 1983 formulated in alignment with the Alma-Ata Declaration 1978. Health for All by 2000. It focused heavily on establishing a network of primary health facilities in rural areas. NHP 2002 that shifted focus to expanding the healthcare network, controlling infectious diseases, and increasing primary healthcare investment. NHP 2017 that replaced NHP 2002 to address a dual burden of disease like infectious plus non-communicable diseases, changing healthcare priorities and rising out-of-pocket expenses. Now let's look into the key target indicators and goals. The first one is key financial commitment, 2.5% of GDP by 2025. So NHP 2017 explicitly mandates raising public health spending from approximately 1.15% to 2.5% of GDP in a time-bound manner. It advises state government to allocate more than 8% of their annual state budgets to healthcare to strengthen regional infrastructure. Now let's discuss key health targets and milestones. So increase life expectancy at birth from 67.5 to 70 years by 2025. Reduce infant mortality rate to 28 per 1,000 live births by 2019. Reduce maternal mortality ratio to 100 per 1 lakh live births by 2020. Reduce under 5 mortality to 23 per 1,000 live births by 2025. And TFR, total fertility rate target, set to 2.1 by 2025. And also disease control, eliminate Kala-Azar and lymphatic filariasis, short to mid-term plan, and maintain leprosy elimination. Now, what are the major strategic policy shifts in NHP 2017? So, first one is selective to comprehensive primary care, upgraded sub-centers and primary health centers into health and wellness centers. So that is transition from selective primary care to 150,000 plus health and wellness centers delivering comprehensive, non-communicable and diagnostic care. And reduction of out-of-pocket expenditure, guaranteeing free essential drugs, diagnostic and emergency care in all public facilities alongside PMJ, secondary or tertiary insurance cover. And digital ecosystem, National Digital Health Blueprint Framework, establishing unique Aadhaar IDs, e-health records, e-Sanjeevani, telemedicine, and disease surveillance. These are the core strategic pillars. When we look into the epidemiological transition of the disease burden shift is obviously towards the NCDs now in India. So NHP 2017 responds directly to India's shifting disease burden, moving focus from traditional infectious disease conditions to chronic non-communicable diseases, NCDs like cardiovascular conditions, diabetes, and cancers. Now the primary healthcare transformation. So NHP 2017 re-engineered the primary care delivery in India. The health and wellness centers, sub-centers upgraded to Ayushman Arogya Mandirs, expanded care package to all essential services including mental health, oral care and eye care. Mid-level health providers, community health officers, that is CHOs, stationed at primary healthcare level, sub-center and PHC level. And free essential drugs, reducing out-of-pocket spending on outpatient medication. The partnerships and mainstreaming Ayush. Strategic purchasing, partnering with private sector to fill public capacity gaps in secondary or tertiary care without compromising quality or affordability. and ensuring strict quality standards, transparent pricing, and alignment with national health goals. Pluralism and Ayush integration. Mainstreaming Ayush, Yoga and Naturopathy, Unani, Siddha, and Homeopathy into public health centers. Co-locating Ayush services to encourage preventive lifestyle interventions alongside modern medicine. Now, when you critically analyze, the strengths are shift towards preventive wellness, strong focus on financial protection. But when you look into the challenges, the implementation challenges, so fiscal spending deficit, the public spending has historically hovered around 1.3 to 1.5% of GDP, remaining below the 2.5% benchmark target. So which means a public spending targets, that is 2.5% of GDP, have historically lagged behind the stipulated deadlines. And the next is the health remains a state subject according to list 2 of schedule 7 of the Indian Constitution. So this leads to disparity, leading to execution disparities across states. So creating wide interstate variation in health infrastructure and budgetary execution. Now the HR shortages, persistent deficits of specialist doctors, nurses and technicians in rural public health centers. And obviously the out-of-pocket burden, out-of-pocket expenditure remains significant, causing medical impoverishment among vulnerable groups.